Bismillah ar-Rahman ar-Rahim. The title of this study is starting with a question that is a volume of 3.6 ml better than 1.8 ml for inferior alveolar nerve block in a patient with symptomatic irreversible pulpitis. As you know that the failure rate is high for inferior alveolar nerve block, especially if the tooth has a symptomatic irreversible pulpitis. This article was published in GOE in 2013, and this is a reader group by Fowler and a reader. And the aim of this study to determine the success of inferior alveolar nerve block using either 3.6 ml or 1.8 ml, means that 1 carbole or 2 carboles, of 2% lidocaine with 1/1,000 over 100,000 epi in a patient presented with symptomatic irreversible pulpitis. In this methodology, they use this retrospective study of 7 previous published studies. 319 emergency patients with symptomatic irreversible pulpitis were included in this study. All teeth were vital, and all of them was mandibular molars with a prolonged response to cold test. Exclusion criteria in this study was if the patient is younger than 18 and if the patient report any allergy, pregnancy, or significant medical condition. Patient taking any medication that affect pain assessment, such as analgesic, or active infection in the area of injection. And lastly is the patient with no response to cold test or no vital coronal pulp tissue upon access clinically. Patients were divided into 2 groups. The first group was injected with 1.8, which is 1 carbole, and the second group was injected by 3.6, which is 2 carboles. And the total number of each group is 129 patients. All patients were required to have a profound lip numbness after inferior alveolar nerve, and that was the sign of the anesthesia, successful anesthesia. If the patient felt pain during the access, treatment was stopped, and the patient rated the discomfort from the level using a VAS, which is the visual analog scale, and they categorize it into 4 categories, which is no pain, mild pain, moderate pain, and severe pain. After that, they run the statistical analysis for anesthesia success between the 2 groups. From the result, that success rate of 1.8 was 28%, and the success rate for 3.6 was 39%. However, statistically, there is no significance between both volumes. And to conclude that, the authors conclude that there is no significant difference between 2 volumes, giving 1 carbole or 2 carboles, and either volume were not high enough to ensure complete pulpal anesthesia, and they recommend that other supplemental anesthesia would be helpful in this kind of cases. Thank you.